I am Alexis Kliethermes. I'm a first semester nursing student. It's November 14, 2019. It's 11:30. We're demonstrating how to insert an NG tube today. So the first thing what I would do is check my patient's chart to make sure there's an order from the doctor, which there is. So I'll go ahead and go into my patient's room, do hand hygiene. Hi, Miss Jones. Can you tell me your name and date of birth, please? Perfect. Thank you. I'm Alexis. I'm going to be your nursing student today. We're going to insert an NG tube that was ordered by your doctor. Is that okay? Are you aware of any allergies, latex, or anything? No? All right. I'll go ahead and assess the patient's mental status and condition. I would ask if they have had any nasal surgery, nasal or septum deviation, and then I would also assess their gag reflex. And I would assess the nares on which one has more oxygen coming out, and I would do it in that one. So now I'm going to go ahead and close the curtain for privacy. I would go ahead and raise my bed up to a working condition for me. I would also determine the tube size I will be needing to use on my patient. I already have all my supplies gathered, so I will go ahead and put my patient in a high tolerance position. So the first thing I would do is put the towel on my patient in case any excess fluid comes out or anything.
Okay, I'll set it up.
Alright, I'm going to do some hand hygiene. Now I would assess the nasal by using a flashlight, and then I would apply pressure. Perfect. Can you take one deep breath or breathe out? Good. Perfect. Alright, so now I could go ahead and measure my tubing. Before I measure, I'm going to go ahead and give my patient their water cup. I will not measure from the nose to the ear into the xiphoid process. And then I would mark that. Now I would lubricate it 2 to 4 inches into water. But before I completely lubricate it, I will put a pair of clean gloves on. Because of hand hygiene. Miss Jones, we're gonna go ahead and get this started. If you're feeling any pain or we need to stop this procedure, I'm gonna have you raise your right arm. Alright, I will go ahead and finish slimming this 2 to 4 inches. Okay, very good. Curling it around my hand, I will go ahead and put my patient's neck back. Just a little. Can you tilt your neck back for me? Thank you. I'm going to go ahead and insert it. Pointing it downward. Okay, take deep breath. Thank you. Alright, now they will get take a sip of drink. Every sip of drink I will insert an additional 2 to 4 inches. And I'm going to have them lower their neck. Can you go ahead and lower your neck for me? Alright, I'm going to make sure I'm rotating it at a 180. Sip. Okay, and it's all the way in there. So now I could go ahead and tape this through their cheek temporarily while I check to make sure it is in the correct spot. Okay. So the first way I could check is by having them talk or move their tongue so I can make sure it's not coiled on the back of their neck. Can you push your tongue out and that it's not coiled? So I could go ahead and take out some secretions, and I would check the pH level. Okay. So I would put the secretions on a pH strip, and if it's no greater than 5, then I know it's in the stomach. And then now I would go ahead and put any extra secretions I have back in so it doesn't cause an imbalance in electrolytes or nutrition. Okay. But for this procedure, I will be doing it by instilling air into the stomach, and if I hear a whooshing sound, then I know it is in the correct place. So the first thing I'm going to do is put my stethoscope on. And I'm going to listen while I'm instilling the air. I heard the whooshing sound, so therefore I know it is in the correct spot. The most accurate way to make sure it is in the correct spot is by doing an x-ray. So now I could go ahead and remove my gloves. Move those away. Do hand hygiene. And now I could permanently tape it to my patient. I'll just go ahead and remove this tape. So I'll do this by the split. Put this on the bridge of the nose. So now I have attached to the patient, we'll go ahead and do hand hygiene. At this time, I could use this NG tube for substaging if I needed to. I could administer medications through this, or I could do a continuous feeding or any other feedings off of this tube. Now that it's inserted in the correct place, I would go ahead and date, time, and initial it when I put it in. I will move this towel. We'll attach it to my patient's gown, giving him room to move still. Alright, Miss Jones, we're almost done, okay? I'm going to go ahead and lay her back into a comfortable position. That's good for her. Okay. I'll go ahead and lower the bed back down for the patient's safety. Alright, now I could go outside and document how the patient tolerated the procedure, what size tube I put in, and the ways I checked to make sure it was in the correct place, which the x-ray would be the most accurate, and then I personally checked for instilling air and listening for whooshing over the stomach. You could check by taking out secretions and doing the pH strip, and then making sure it's not coiled in the back of the throat. So that completes it.